Cathaoirleach, today I rise to my feet to address the issue of health insurance and the revelations that many people over the age of 60 years of age are paying more than €1,000 more than they ought to be for their health cover. The report was compiled by totalhealthcover.ie and concluded that at least 2 out of every 5 people are on outdated plans and on very much overpriced plans. I had a lady into me and she was paying nearly €4,000. When she rang the insurance provider to inquire after her what other health options might be available to her, she was given no guidance and she was asked to pick and choose what she would like covered. These policies seem to be deliberately put together in a way to confuse people and to not be able to understand them. How is anyone meant to pick and choose what ailments they'll be suffering from in the next few years? Nobody can look into the future. This scaremongering by insurance providers is outrageous. Elderly people are already vulnerable and in their homes on their own in many cases. I'm asking very simply, which I don't think there will be any cost associated with it, that the Minister for Health direct the Insurance Ombudsman to set up a side office, to help those navigate and review insurance policy so that the elderly and the most vulnerable are not shouldered with the burden of funding our health service. However, in the long term, I believe we need to look at a publicly funded healthcare model. We already have one of the highest spends per capita on healthcare compared to many of the richest countries. We need to identify efficiencies and implement them. The idea that health insurance is going to increase by 50% in the next decade is absolutely scandalous. The system needs to change and it needs to change rapidly.